Ladies and gentlemen, Congress speakers, GUNA partners, auditors, journalists, and all the ones who are following us via streaming, welcome to Milano and to the first International Congress Collagen in Musculoskeletal System Disorders, a journey through pain relief, tissue repair, and functional recovery. I cannot begin my short presentation without thanking GUNA and its president, Dr. Alessandro Pizzoccaro, and in more specific, the GUNA Export Department, in the names of Dr. William Cinquanta, Dr. Stella Pizzoccaro, and their staff for their devoted efforts and the care in organizing this Congress. A thank you also to Dr. Nicola Talamo, the responsible of the Italian branch concerning the collagen medical devices. This team worked together, forming a squad in which two words were present: cooperation and collaboration. I thank you also the authors of the website MeteoWeb, Doc Player, Infarm Mag, Milano Today, that already advertised this event. Their will and their desire to perform well, constructing and building this Congress that I am going to open is at least equal to their satisfaction today to see more than 250 people attending the Congress works, with 11 Italian and foreign speakers belonging to 6 different European countries. Welcome to all. This historic first Congress on Collagen MDs surely will allow us to share and compare the experiences and studies, as well as to point the finger towards the state of art on these very innovative and peculiar medical devices. We thank you all for your very large participation, clear and outstanding sign of the progressive success of collagen medical device are having so far, and will have in the development of medical sciences. In only 6 years since they have been officially presented, the GUNA collagen medical devices have spread their application in many medical specialties: orthopedics, rheumatology, rehabilitative medicine, neurology, cosmetology, and in general practice. Even veterinary doctors in recent years have appreciated the use of collagen MDs in small and large animals. The flexibility of the collagen medical device for their use in extra-articular and intra-articular injection, as well as in trigger points in manual physical therapy and instrumental physical therapy, as electrotherapy, magnetotherapy, laser therapy, and T-card therapy, give to the clinician a great tool and challenge, and to the patient a great opportunity. Their efficacy, safety, and perfect compliance definitely are the 3 key words to open the door of the therapeutic success. Thank you so much. My first slide, Which finger I have to press? This is the first article on collagen medical device published in Physiologic Regulating Medicine 2010. I was presenting the bioscaffold properties of the collagen and its clinical use. With the use of MDNE, an Italian author, Dr. Posabella, published the patellofemoral chondropathy treated with medical device knee, ZLT, and multi-target, multi-complex homeopathic medicine transmitted via oxygen versus nimesulide and chondroitin sulfate. This has been the first clinical published use of medical devices. Immediately, the collagen medical devices have been appreciated abroad, and here we have the work of Professor Pavelka, Karel Pavelka, of the Institute of Rheumatology of the First Faculty of Medicine, Charles University in Prague. MD Lumbar, muscle and neural in the treatment of low back pain. Also, this female doctor, Dr. Falconi Klein, introduced the use of medical device in biolifting and in cosmetology. In 2012, just 2 years after the introduction of the MDs, Dr. Nestorova published this article, Efficacy of Collagen Injections of Guna MD in Patients with Gonarthrosis Assessed Clinically and by Ultrasound. Professor Zocco, also with MD Lumbar. Here, after 3 years, I am the author, published with the very first 10 experiments, 10 clinical studies and clinical assessment already published in 2 years, in 3 years, because it was from 2010, 11, 12. It was the very first state of art of how the things were going, and the different countries were interested and involved in developing the medical device. I cannot forget the work of Dr. Rashkov, Bozhnyakov, and Tichkev, and those are the titles. A very good work by the Physical Therapy and Rehabilitation Unit, Molinette Hospital, University of Turin, Dr. Milano. Now he is the chief of this department, with the use of MD hip in hip gonarthrosis. Muscle, tissue, matrix, and neural, Dr. Alfieri, who is one of the speakers of today, in sport medicine. In the magazine Movement Disorders Bulgaria, with the use of MD Lumbar and MD Ischel, Dr. Rashkev did this publication. And in European Journal of Musculoskeletal Disorders 2014, with the use of MD Shoulder and MD Matrix, Dr. Nestorova et al. published the results of their experiments. Here is the first with Dr. Beni Akir, the first use of MD lumbar and MD hip in horses, sport horses. So the first vet clinical work published. Here you have a great large experiment on 257 patients with different treated with different collagen medical devices injection according to the different pathologies. And Martin, but the person who kept the files of this article, Professor Migliore, who will be speaker today, a blind published on BMC musculoskeletal disorders 2016, a double-blind randomized active controlled clinical trials on the intraarticular use of MD knee versus sodium hyaluronate in patients with knee osteoarthritis. The study was called JOINT. JOINT means this kind of study, the name with which it was registered. The latest clinical trials, not yet published, will be at the end of 2016, accepted paper by current medicinal chemistry, Professor Pavelka, ongoing studies with Professor Santilli, the head of Department of Science of the Musculoskeletal System Surgery Unit, Sapienza University, Rome, and this is the title. We shall read in very few time. And Dr. Loberti of the Department of Otolaryngology, Tor Vergata University, Rome. So you can see that many universities and many persons working in universities, chief of universities, departments, are deeply involved in the project medical devices. So now in red, these are the 16 European countries in which the medical devices are used and commercialized. Already in red, Bulgaria, Croatia, Czech Republic, Greece, Hungary, of course Italy, Lithuania, Poland, Portugal, Romania, Serbia, Slovakia, Slovenia, Spain, Turkey, United Kingdom. And in blue, the work in progress registration distribution in other 6 countries: France, Germany, Moldova, Scandinavian countries, Switzerland, and Ukraine. This in Europe. In the Middle East, already in Israel, in Palestine, and in Jordan. And in progress distribution will be very soon even in Egypt. Southeast Asia, Vietnam. Welcome, because you are coming from the very far other parts of the world, 12-hour, I hope no jet lag. Anyway, we do thank you because you have been the very first Asian country to accept, appreciate, and use the medical device. Very soon, even in India. And 2 South American countries, Chile and Paraguay, and very soon, work in progress distribution and registration in Brazil, Colombia, Guatemala, Mexico, and Peru. I do thank you so much for your kind attention, and welcome again to Milano, and happy life to everybody. Thank you so much. Yes, yes. Me sale natural también saludar a los amigos que vienen de España y de los países sudamericanos. Bienvenidos a Milán y que tengan buena suerte hoy día en este congreso, pero también por toda su vida, felicidad y buen comercio. Bienvenidos. Prima di cominciare I lavori congressuali.
Before we start Congress works, I have the pleasure to introduce to you Marinella Loddo. Marinella Loddo, who was hidden behind me, but she should stay next to me. So she's the director of the ICE office, so the Office for Foreign Commerce of Milan.
Director of the Institute for Foreign Commerce of Milano. La doctora Marinella Loddo es la directora del Instituto para el Comercio Extranjero de Milano. Prego, dottoressa, siccome sono chairman, 5 minuti.
Perfetto.
She has 5 minutes time. I will respect the timing, and I'd like to thank Professor Milani because as a patient he has opened my mind through this journey through pain relief. As a representative of ICE, which is the national agency promoting the internationalization of all Italian businesses and enterprises and companies, I welcome all the delegates, and I hope this first International Congress will be followed by following editions. I'd like to thank the chairman of GUNA, who is in the back of the room. So I'd like to thank him for the invitation and for the international scope of Congress. You said good business, good trade. Business and commerce is trade through competence and skills. And for those of you who do not know ICE, this is the agency that promotes the productive system in Italy. We have offices throughout the world in over 60 countries. I've seen people from Chile, from Vietnam, and this will be an occasion of additional contacts. And I'd like to thank Dr. Gorga, because he has been our contact for future activities in this sector. Thank you very much. And I think I respected my 5 minutes time.
To stay in their own time. They have 30 minutes. They have not to go over these 30 minutes, otherwise it will be less time for others. So please stay in your time. The very first speaker of this morning is Dr. Georgios Basdekis from Greece. Assessment of the effects of ultrasound-guided percutaneous drilling, irrigation and infiltration with collagen medical devices in tendinitis and in rotator cuff calcific tendinopathy, compared to the effects of subcutaneous use of collagen medical device. You have the word.
Good morning. Kalimera, buongiorno. Thank you very much. I would like to thank Guna for this honor to be here today in the first International Congress of Collagen MD. It's a study that we perform with ultrasound percutaneous drilling, and compared with the use of subcutaneous use of the, is the other side? Okay. Is there any role of collagen MD in this regenerative medicine and orthopedics? The most important things, I have not a laser point, is that we need cells, we need the signal, we need scaffolds, and I believe that there's the role of collagen MD in this kind of medicine. So our study is about the calcific tendinopathy and tendinitis. It's a chronic problem. This is, so the cases are very difficult, and we have the fail of healing response on tendon with proliferation of tendinocytes. So as you can see, you have a laser point.
The laser point, I can give you mine. Yes. It does not work. No. It works, but not. I can see it.
So, excuse me. I continue. So it's not so important. So as you can see in the image, is in some cases are very difficult with chronic calcific tendinopathy. So why ultrasound guided percutaneous drilling? I believe that it's very difficult to find the point and to be in the injury, and this is why we test this, how it works with drilling and irrigation and filtration, or without. So with the ultrasound we can guide and mark the point. As you know, the therapy option in this tendinopathy are drugs, non-steroid, injections, cortisone, PRP, ozone, cortisone destroy the tendon, collagen D, shockwave therapy and viscotherapy, and at last arthroscopy or open surgery to remove this and to repair the tear of the calf. We use these three medical devices, MD knee, shoulder, and MD tissue. Why I use a lot of knee? Because I believe in arnica. We did a control study with two groups, 20 patients each, with the same disease. And the first group, as we say, was ultrasound, and the second was subcutaneous collagen. The first group mark the point and go needle, aspirate, and infiltrate with the collagen MD 3 times, once every 15 days. It was between 1 to 2 centimeters deep inside the injury with 21G needle. In a lot of cases, we use 2 needles, one to mark and to aspirate this also, and put inside in the injury the collagen. The second group was again with the use of ultrasound, because we mark the lesion, go around this lesion with a 27G needle, and we did 5 to 7 small skin needle 3 times every 15 days with the same collagen. We got all this with a constant score, with the Excel was in this was the 100, VAS score, and with the usual ultrasound follow-up. The results in constant score, the first group was 33 and 35 in second group, similar. Before the start the therapy. In 2 weeks it was 51 to 53, close enough, and in 6 weeks 69, 55. Some you have 1 month and a half, 6 weeks after the therapy, you have a better result in the first group where was the infiltration aspiration. And in the end of the therapy, in the control therapy, because in some cases we lost, some cases we did again continue the therapy. The results was better for the first group. VAS score, as you can see, before was the pain that the pain was the reason that they came to us. 2 weeks after the pain after the first visit, start to decrease the pain, and 6 weeks after was the patient was satisfied, they could sleep the night, and the results 1 year after was very, very good for both groups. The ultrasound, and the question is the pain in the ultrasound in these lesions. You know, we have not, in some cases, we have very good results for the images, ultrasound images, without disappear the calcific, but or decrease the calcification. The first group was 17 of 20 patients, the second group was 12 of 20 patients. But the most important was the pain. And in some cases also the healing of the tendon is question. If it comes because the tendon is very bad material with bad collagen, so it's very difficult. The other point that it was this: in the cases, the first group, we did all this traumatic scarification of the tendon. The patient used more non-steroid drugs than in the second group. We don't. My advice is not to use only pain relief drugs, paracetamol or something like this. Not use non-steroid, but in some cases they need that. And but after the second visit, the patient that they used non-steroid drugs was less in the first group than in the second one. So our results, the conclusion is that both methods are safe. This is very important because we used more than 3 medical devices together. Excellent results with needling and infiltration aspiration, because tendons in chronic disease and tendons without very good blood flow, and so both pain relief and less use of non-steroid than the other patients that we did not use collagen MD. Thank you very much.
Thank you, Dr. Bazdekis.
I was fast, yes?
You have kept my suggestion. Yes, you will speak this afternoon
yes,
also. We do. Thank you so much.